and clinic. The title of this webinar is Engaging Resettlement Staff in Alternative Programming Beyond Executive Orders. As you know, much is in flux regarding resettlement arrivals for this fiscal year. We do expect a severe reduction in the number of arrivals under the Trump administration. For that reason, we want to proactively strategize on how to shore up the refugee resettlement field for the years ahead. We're glad you're joining us on this topic. My name is Jean Beal. I'm the Senior Vice President for Programs and Services here at Catholic Charities USA. And I'm joined by Elizabeth Harshaw, the Associate Director of Resettlement Services at USCCB MRS, and Jeff Chenoweth, Clinic's Capacity Building Section Director. Just a few logistics for this webinar. This webinar is being recorded. We'll send out the link later. And also the slides are already attached to the software in the rectangular box on the right side of your screen. They will also be posted on CCUSA's website and sent to all registrants. Please mute your phone lines or computer speakers, and you can use the chat feature for comments or questions during the presentation. We'll be monitoring that, so if a question comes up that seems to be at the right time of the presentation, we'll ask that question then. If not, we'll have additional time for Q&A at the end. So our goal today is to identify resettlement staff talents and skills, and then to engage them in creative alternative activities. We have a handful of objectives to achieve today. We want to identify resettlement staff talents and skills, provide ideas for resettlement staff repurposing activities, look for additional ideas from you as the webinar attendees, take questions, and then identify at the end some resources so that you can follow up when we're finished. So the first thing we want to do is have a poll, and this slide is going to be replaced by the polling question. So please take a few minutes to respond. About half of the group have voted. Now we're about 75%, so you have a few seconds more to get your vote in. Okay, close the poll. So it looks like 38% of you are have to have a half-time to 5 full-time, 31% have 6 to 10 full-time staff, 23% have 11 to 20 full-time staff, and 8% have 20 or more full-time staff. So the largest group is small programs. Thanks. So now we want to turn this over to Elizabeth to talk about resettlement staff talents and skills.
Thank you, Jean, and good day, everybody. Again, Elizabeth Harshaw here with USCCB. So in keeping with the goal to identify talents and skills among the resettlement staff, some of these are listed here on the slide. And the idea is that they will help us to think about repurposing and alternative work opportunities. The thinking is that by looking for the multidisciplinary skills that many in the resettlement field possess, it will help us think about repurposing and alternative work opportunities. So what have we got here in front of us? We've got prior education and work experience outside of the U.S. Many of the folks who work in refugee resettlement have worked in other countries. Additional education and work experience. You know, many in the resettlement field were perhaps doctors or dentists or some other profession before turning to case management or turning to work in the resettlement field. They come with language. They're multilingual, speak many different languages, many different dialects. They come with experience and cultural competency. They work with a portfolio of clients from many different countries. They have knowledge of the immigration law and procedures. Some of them are BIA accredited, paraprofessionals in the immigration field. They have case management and safety net service experience and understanding, crisis management and counseling that comes along with that. We'll continue to the next slide. They have teaching, and it'll pop up. They have teaching and public speaking experience also, and advocacy, particularly at this time, community outreach and education. Many of the folks in the resettlement field are doing quarterly consultations and engaging with many different partners, from political to service providers to community members. They also have skills in job placement, public relations, partnership, and that involves marketing the program in order to partner with employers to place refugees. Volunteer coordination, that's an activity that's baked into many social service organizations. So they've got experience coordinating volunteers in resource development, finding all of those material goods that newcomers need when they arrive in the United States. So they come with a plethora of skills and talents that can be marketed. And perhaps you can identify more by identifying more and typing those into the chat box. I apologize, I can't see the chat box, but perhaps you can type some of those in and we can share some of those later. We'll move to the next slide then. So then repurposing planning. So we've listed these skills and talents that the resettlement staff have. And so then we want to start thinking about how you can use these to plan and implement a repurpose initiative for your resettlement staff, hoping that a number of you have already begun thinking about this, and so this will be an additional step in that journey. And for those who haven't, it's a nice comprehensive list of actions for you to take and ideas for you to think of. So number one, perhaps starting with scanning staff for their known and unknown skills. So you want to collect updated resumes, perhaps, and interview staff individually or collectively to learn more about their histories and their skills. You want to secure the leadership vision and commitment and work with the human resource director. You'll do that to ascertain leadership's commitment to modifying the scope of services to the foreign-born and ways to prioritize current staff for other positions if they're qualified. Remember, including your board members if they can be helpful in the repurposing plan. And this is very important. View migration services as mainstream. Think about the skills of the staff and the needs of immigrants in your community as mainstream services, not just this isolated pocket or an isolated, distinct population. It's a vulnerable population that a whole agency, that should be part of the whole agency. And you want to work towards the full integration of newcomers and welcoming them in the community. And then number four here, learning what others are doing. So how about talking with your other resettlement directors in the community and across the Catholic network nationally to get new ideas? Identify if regional or national projects might be undertaken. Seek creative partnerships. Think about assessing the potential for new or expanded partnerships in and outside the resettlement community. You want to think fresh. Think fresh. 6, prioritize your opportunities. Select ideas that are feasible and have the highest impact on the needs of your community. And some examples of those, and perhaps I've heard these from partner agencies, thinking about repurposing staff to provide interpretation services, or if you aren't a clinic affiliate, providing immigration services. Some of you do mental health services or support groups with newcomers. Think about ways of billing Medicaid for those kinds of services. So that's that think fresh. And then, creating a business plan and a budget. Put ideas into a budget of potential revenue and expenses so leaders can get behind a plan. See it in writing, see something solid. And seek alternative funding. Work with your leadership and your executives from other organizations to cultivate donor interest in repurposing resettlement staff and serving the community needs. Consider fees for service. Identify if any services can be expanded or provided new and have potential to draw from fees as revenue, whether those fees might be from client fees if you're providing immigration services, or other federal source funding, fees from Medicaid if you're providing mental health services, interpretation if you're doing interpretation, fees from perhaps the school or a hospital if you're using staff to provide interpretation services. And then number 10 here, retrain and create work plans. Now think about identifying skills that need to be learned. What are new skills that staff perhaps need to learn? Who can train? Give staff new work plans to guide and assess their efforts. So you've got 10 concrete steps there. And then here, some immediate actions, some things to think about. Consider conducting a needs assessment in the refugee immigrant community with service providers, schools, elected officials, to identify and better understand what opportunities are out there. Hold listening sessions to hear what kinds of programs and services are needed and desired, where are the gaps, and then plan accordingly. Also, what services have you been wanting to offer in the past but could not due to time, staffing, other constraints? Here's an opportunity. Consider accessing preferred communities VCS funding. That's the distinct stream of dollars that comes through USCCB to provide case management services to vulnerable ORR eligible populations. USCCB has had this funding for a while. We had suspended the operation and are about to reinitiate by the end of this month. And so there's some per capita funding available there. Consult with USCCB on engaging staff to combat human trafficking and survivors. It's another potential funding stream. Consider becoming a remote placement program to serve a small caseload at a distance. So those are some concrete things to think about. So with that, I'd like to turn the webinar over to Jeff Chenoweth from Clinics.
Thanks, Elizabeth. Here are more ideas to engage resettlement staff, starting with public education. There is an ever-increasing need for public education at this challenging time of misinformation and polarized opinions. Public education can take many forms, like public speaking to friendly audiences, speaking to media or elected officials, writing opinion pieces for local newspapers, speaking on television and radio, or organizing a public education message using social media. Whatever the format, we have important things to say about what we do and why we do it. It is chiefly driven by Catholic social teaching, which people of different faiths or of no particular one can admire when shared in a contemporary way with relevance to our current challenges. This is a good time to practice short, powerful messages as to what we do and why. So work with staff to have messages tailored for different events and audiences, focusing on your organization's mission, compelling elements of Catholic social teaching beyond religious affiliation, the positives of immigration and how our country depends on immigration to shore up, say, the social security system, process food, products that we eat, work in industries that lack employees, etc. Focus on how hate messages are not a part of our best American tradition and risk not only dividing us further but causing serious harm, if not death, to minorities. Create messages asking people to give their money and time as volunteers to support your services. Here's more public education ideas. Inasmuch as possible, with staff and funds, reach out to the asylee populations and integrate them into your services. Identify communities that are underserved and which organizations are most concerned about their full integration. Contract with local service providers, public and private, to serve their clients. Perhaps other social service organizations have need for your staff's talent to serve their clients better and can provide financial support to do so. Just recently, Catholic Charities of Oklahoma City was successful in getting its resettlement staff seconded over to the United Way for an interim period in order to bridge them during this uncertain time. So well done, Catholic Charities of Oklahoma City. Update website materials. If you know a website is the method targeted populations get information from. If yes, make sure the materials are accessible, like translating them. If not, and social media tools are more commonly accessed, build up your organization's tools, your social media tools. Use all your public education tools to explain what you do and why and how people can help your efforts with money and volunteer support. Again, translate materials and then create or expand your social media messages and solicitations. Now let's look at advocacy efforts. Our advocacy efforts are probably well below the amount each nonprofit is permitted to perform according to tax code regulations. We can probably do more with the staff we have working with non-government funding. So, for example, become local Justice for Immigrants JFI ambassadors. That's my term. JFI evolved into a large group of grassroots advocates, but can benefit from more engagement even within the Catholic Church, where people are still fairly divided on what our country needs in the form of immigration laws and immigrants. Organize JFI and other pro-immigrant events that are social as well as policy-driven. Educate elected and appointed officials locally, nationally. We need local officials to be well informed by residents to whom they are accountable. The same is true for our nationally elected and appointed officials. Local stories matter, so demonstrating how bad laws and policies hurt families and communities must be told. And then community organizing. Community organizing is an important part of advocacy. Be trained and train others on leadership development and organizing skills. There are many nonprofits skilled in training others for leadership roles. You wouldn't necessarily have to create the curriculum. Many newcomers to the U.S. were leaders in their home countries and can learn advocacy skills in the U.S. context to help make laws more fair on immigration and other social justice matters. Organize refugee and immigrant populations together. Although the U.S. is a very diverse nation, we are still surprised to see groups come together across racial and ethnic lines to support a common cause. Is your city a formally recognized welcoming community? Welcoming America, a nonprofit, has succeeded in working with local residents across the country to make their communities welcoming in name and in activities. So I encourage you to visit Welcoming America's website for their resources on how to make your local community an official welcoming community. Does your community need an ID program by which undocumented persons can have a city-recognized document made by a nonprofit or the city itself by which undocumented people can access services? Learn how other communities have succeeded in this effort by visiting the webinar link provided on the slide. Teaching. Many Catholic agencies might consider expanding their teaching services. See if local instructors can collaborate to expand their classes and utilize resettlement staff in the process. Satellite campuses might be established and utilize resettlement staff as teacher aides. Are immigrants lacking access to credentialing programs that provide better, higher paying employment? See if resettlement staff can identify the need and how more credentialing training can be made available with public or private funding. Teach ESL classes for different levels of learning, either in partnership with GED and community college programs or one started by your organization. Gain experience in the formalities of teaching English so that the program can compete for state funding. Then teach naturalization classes for U.S. citizenship test preparation purposes. 8 million immigrants are eligible to apply for U.S. citizenship now, but haven't done so. Too many immigrants wanting to become citizens think the test is too difficult and they don't want to fail or lose their application fee. Yet in truth, the test is passed by almost 92% of people who take it the first or second time. So teaching the classes gives people great confidence to apply for naturalization and also pass at a very high rate. Then consider staff teaching non-English languages for refugee youth and other learners. Research shows that immigrant families are more cohesive and their youth thrive more when there is a shared language between the generations. So teaching non-English classes is an option. And then, as mentioned earlier, volunteer coordination. At a time like this, people are looking to engage their values in positive ways. How can your organization, in and outside the resettlement program, use more volunteers? How can resettlement staff be repurposed to attract, train, and support volunteers? Consider creating a volunteer coordinator position if one doesn't exist for the agency. Add another position if feasible. And recruit volunteers from government and private sources. Many young and retired people are volunteering in higher numbers. They are attracted to organizations that reflect their values and hopes. Volunteers, when treated well, can become excellent ambassadors for your organization's mission for years to come, even after they leave your place of volunteering. And then consider how you can highlight volunteer efforts in writing and through appreciation events. Use resettlement staff to systematically show appreciation to volunteers in word and in action. Then immigration law is another career track for resettlement staff. Some resettlement staff today are also authorized immigration legal representatives through the Department of Justice accreditation program. As of last month, the name has changed from Board of Immigration Appeals, or BIA, to DOJ accreditation. I think we can agree that refugees, asylees, and other immigrants don't access authorized practitioners enough. We know this because unauthorized practitioners, also known as notarios in the Spanish language, are plentiful. So I recommend that you talk with your Catholic Charities Immigration Legal Director and discuss the need for expanding services using resettlement staff. See what the needs are. Are one or more resettlement staff able to become DOJ accredited with the Immigration Director's support? So consider helping resettlement staff access clinic training to gain authorization to practice immigration law. Clinic's online course titled Comprehensive Overview of Immigration Law, or COIL, C-O-I-L, is a fast and economical way to gain training for DOJ accreditation. See the link on the screen for registration, which is open now for the next course. You may also want to send resettlement staff to Clinic's annual convening in Atlanta from May 24 to 26, in Atlanta, May 24 to 26, where there will be a CCUSA Communities of Practice meeting on immigration, in addition to extensive immigration law training sponsored by Clinic. So see our registration link, which is on the screen. For details on the accreditation application process, visit Clinic's DOJ Recognition and Accreditation Toolkit. Our toolkit is linked for your convenience there. Ultimately, we are seeking to have resettlement staff become authorized immigration legal representatives with Catholic Charities support if this is feasible. So more on immigration law training. Whether someone becomes an accredited representative or not, resettlement staff can become a citizenship navigator, specifically through Clinic's ORR-funded project. Navigators are trained to promote naturalization benefits and requirements in the refugee and asylee communities. This can extend beyond other groups as well. Whether accredited or not, resettlement staff can help legal representatives organize adjustment of status and naturalization application workshops. These events require administrative support. Workshops are community events where trained staff and volunteers gather groups of eligible applicants for one or more application purpose. Refugees are educated in advance of the workshop on how to come prepared to complete a green card application, an application for naturalization, or another immigration benefit. This is a good way for different resettlement agencies in the same city to collaborate and help refugees on the path to U.S. citizenship. And resettlement staff who are accredited and experienced can screen immigrants, including undocumented persons, on their potential eligibility for an immigration benefit, benefits that they didn't know they could access prior to gaining a proper legal screening. So again, talk with your immigration legal director about this activity. So this concludes my portion of the presentation, and I'm going to turn it back over to Jean.
Thanks, Jeff, and thanks for the call out on our community of practice meeting at the clinic convening. All right, so now it's time to take another poll, which we are opening up right now for you. We're looking to get you to tell us, of the ideas presented, which category is most useful for you and might be implemented by your program. So take a few minutes. We're going to see how many people have voted. We have about a third of the group has voted so far. Now we're about halfway there. Okay. I guess we can close it now. So it looks like the majority will be able to, or at least will think about, doing some additional tasks with their migration staff around migration services. Some will also lend them to volunteer coordination, public education, and a few are even going to look at the advocacy and immigration law opportunities. That's great, thanks. All right, so we're coming to the end here, and there are about 30 folks on the line, so we think we may be able to just open the line so that if anyone has a comment or question, we would be able to entertain that now. So Fanny, can you open the lines? Can we open everybody? I would have to do one by one. Okay. Can we open them all though? No? No. Do you want me to open everybody? Yes, you can. Okay. So we're getting a few of them open. And now we have feedback. All right, you know what? We're going to close them again. The feedback's too loud. So let's just, if you have a question or suggestion, please put it in the question box, and I'm going to read them, and then either Jeff or Elizabeth or I can try to get an answer for you. Can we have, how do we access the PowerPoint? So it is right there, actually, in that box where the question boxes are. You should be able to see handouts, 1 of 5. If you open that little section, handouts, you should be able to download the PowerPoint. But worry not, we will be able to also send it to you along with the recording at the end. No. Okay, so Kelly, we actually have your line open if you want to ask your question yourself or make a suggestion.
Hi, Jean. Hi, everybody.
Hi, Kelly.
How are you? Thank you for these suggestions. What I was just writing in the chat box was that since in New York City, here we actually have the majority of our clients are people who have been granted asylum. So I think we're probably not your average site. But something that I've been kind of wishing for a long time is the ability at the federal level or through EOIR to kind of ensure that everyone who's granted asylum and, similarly people who are getting their certificate of they're certified trafficking victims, for example, through ORR, are kind of automatically referred or at least given the information about where their local resettlement offices are. This kind of happens to a certain degree, but because people are granted asylum in so many different ways, whether they are derivative or they're at an asylum office or through a judge or out of a detention, so there's kind of different ways that that people have information. So we constantly are doing outreach, but at the same time, there's not really a coordinated effort at the government level. So I guess my suggestion was if we could do something through clinic or as a group of us with MRS and CCUSA and clinic to really advocate for this idea.
So to whom would we be advocating?
I think EOIR, if I'm not mistaken.
Okay. Do either Jeff or Elizabeth want to comment on that? In which case you might have to unmute your phone. I guess not. Okay, we certainly will take that under advisement, and when we get the best heads together to figure out the best way to do that, we will get back to you, Kelly.
Okay, thank you, Jean.
Great, thanks. Anybody else have a question or a comment? Julie is actually responding to Kelly, it looks like. So Julie, we're opening your line. Would you like to say something?
No.
Julie's comment is we're advocating with the USCCB Asylum Office at the local level for referrals, but we could use some help. Okay, so it sounds like it's a problem that's experienced in more than one place. Are there other questions or comments? Okay then. We have a few more minutes to take a look at the additional resources. You might wish to use these depending on the approaches you take to repurpose your resettlement staff. This slide and the next one will have resources on them. All these links are live. When you get the PowerPoint presentation, you should be able to access them, and you can access them from the recording as well. So in this next slide, we have some partnership tools, volunteer management toolkit. All of these are from Clinic and USCIS, partnering with your local library on citizenship and creating citizenship education and ESL programs. Okay. So unless we see any other hands or other questions, I think we have come to the end of our presentation. You can find most of the resources on the cliniclegal.org website. Keep sharing your ideas and successes with your colleagues going forward. We're going to also be sending the link and the PowerPoint, the link to the recording out on the Catholic Charities USA email discussion list for the Immigration and Refugee Resettlement section. And you should feel free to respond to any of the emails you get from that section by asking your questions or posting more ideas through that email discussion list. We appreciate your interest in this subject and, most importantly, your dedication to rescuing and welcoming refugees in your communities. Thanks so much for your participation. Enjoy the rest of the day.